Thank you very much, Daniel. Ladies and gentlemen, I'm very pleased and delighted to be part of the Bridge to Success Congress. Anyway, I started in Frankfurt and flew to the Gulf region, and unfortunately my airplane approached Qatar and not Abu Dhabi, so now I'm in Qatar and not in Abu Dhabi, but in the time of the digitization and the new work, it's possible to hold a speech even via a video conference. So I'm very pleased to be on air right now in Abu Dhabi. I would like to talk about Invitacare, and thus I'm referring to Jochen Hütter's speech. It's about a description of a psychosomatic concept considering COVID-19. And even though in the program 30 minutes are planned for my speech, I make you a promise I will make it short, as just discussed with Daniel, so that you can get your food and your beverage as you expected it some minutes ago. First of all, I would like to introduce myself to you. My name is Nicolas Krämer. I'm a hospital expert of the Hospital Management Group, a German company being focused on the interim management and the management of hospitals. And I'm doing the healthcare business for 20 years right now. I used to be the CEO and director of several hospitals of various sizes in Germany and acted as a Chief Financial Officer for a hospital in the capital of North Rhine-Westphalia in Düsseldorf. And before that, I was a former project leader with KPMG and Bearing Point. And why I'm here is that I'm a member of the advisory board of the Invitacare company, and I'm a colleague of Jochen Hütter, of Peter Gratzfeld and Uli Aufenberg, to whom I send heartily greetings from Qatar. I was announced as the award-winning author and publisher of several books about hospital management. So here is, as a part of my introduction, an overview over the books that I published during the last 10 years. And the book I was winning the award is Zukunft der Gesundheitsversorgung, so the future of the healthcare system. Many important hospital companies and managers could be won as authors. And this is a question, the healthcare system future, that is being discussed very intensively in the German politics. And one aspect that hasn't been mentioned enough in the past is the question of mental and psychosomatic diseases. So let's have a look on the German healthcare market. What we are talking about is the initiation of an exclusive clinic group in the underdeserved market of psychosomatics in connection with a distinctive, unique selling proposition and an associated branding with the highest demands on a digitally supported, quantifiable, or let's say measurable and outstanding medical offers in terms of quality. So, as just announced, let's look into the German healthcare market. In the last years, the German healthcare market grew by a CAGR of about 4%, and in 2019, more than 400 billion euros and on total healthcare expenditure in Germany occurred. This amounts to about 13% of the GNP. So by that you can see how important the healthcare system or the hospital system for the German economy is in whole. And we have about 2,000 hospitals in Germany, which is pretty much, there is no country in the world with so many hospitals and hospital beds per 1,000 inhabitants. If you look in the year 2015, you see about 345 billion euros healthcare expenditures. And if we look into these 300 and 405 billion euros, we see that about 13%, so 44 billion euros were spent for fighting psychosomatic and mental diseases, with a strong increase within the last years. So in between 2002 and 2015, the healthcare spendings for mental diseases were about doubled. So a strong disease showing how big the demand is in this segment of the healthcare system. And the most important illnesses are dementias, addiction, schizophrenia, affective disorders, neurotic disorders, and other diagnoses which are psychosomatically caused. Most of the spendings, or about 37%, were in inpatient facility, about 50% in outpatient facilities, which is important to know if you consider to build up a new clinic chain like we do at the Invitacare. So in order to rush through the speech, in order to let you get your coffee and your beverages, I will just jump through the next charts. And the main message of this chart is that there is a constant growth, and the inpatient psychotherapeutic and psychiatric case numbers have stabilized on a very high level. And all this was in between 2010 and 2017. So it was before the Corona pandemic. And then in 2020, in February and March 2020, the Corona pandemic occurred. And there was a big poll in Germany asking the people, how much does the Corona situation affect you negatively? And about 50% of the people said strongly or even very strongly, which shows how big the influence on COVID is, not only on your somatic health, but on your psychosomatic health as well. And then there was another poll in 2021 asking the people, did you have more or less stress before the COVID pandemic? And you see an increase from 21 to 22 in terms of, yes, I have more stress, stated by about 31% of the people, and about 50% of the people asked in this poll said, oh, it doesn't affect me at all. And another aspect about psychosomatic diseases is the question of feeling lonely. We had the social distancing, we had the isolation, the quarantine. So the question was in 2022, do you feel more lonely than before? And 70% of the asked people rather agreed. 30% rather agreed with the question. So the Robert Koch Institute, the big public institute of healthcare, stated that mental disorders require special attention with regard to changes in the world of work and the reduction of taboos. So the key word is the so-called new work. And what we are aiming on is to build up a private clinic chain for psychosomatic diseases, since, as I just pointed out, the psychosomatic market in Germany is underdeserved. So we need more clinics like that. And by that, I just jump over it. We said there are three main principles that we would like to state in our Invitacare clinic group. It's about outcome measurement, it's about efficiency, and last but not least, it's about competition. So during the next minutes, I would like to point out what is meant by these three Invitacare principles. Let's go through it one by one. The most important principle is based on the assumption that only what is measurable can be managed. That counts for the industry for many years, but that didn't count for the healthcare business before, because it's always the question how to measure the quality of a hospital, and the same counts for psychosomatic hospitals. So only those who measure results can judge their own quality, recognize mistakes, and evaluate corrective measures, can systemically learn to improve and to differentiate oneself positively, and can evaluate alternative courses of action and make wise decisions. The treatment of the results are a mission, an obligation, and the only reason for a clinic to exist. Because a clinic that doesn't produce good, strong quality will not be visited by the patients. The referring physicians will not recommend to go into this clinic, and the clinic will not have any chance to survive. And if you are, the German healthcare market is not about the prices, because the prices are not interesting for the customer, because the healthcare, the Krankenkassen, they pay for the stay of the patient. So the question is about the quality. So outstanding quality results are a source or reason for loyalty, pride, and motivation of all employees. But by that, the reason for sustainable growth. So after having talked about the measurement of the outcome, I would like to talk about efficiency. For us, for Invitacare, efficiency is the result of a basic attitude of care, of sustainability, and avoidance or reduction of wastage. In an everyday clinical practice, we often experience efficiency as a blunt call for cost cutting and job cuts, the reason for new imposed processes that are not suitable for everyday practice in the long run, and as a synonym for deprofessionalization and downgrading. The third important principle of Invitacare is about competition. We welcome the fact that people make up their minds and vote with their feet. Even if the patient does not request a service from us as a customer, we still accept that he decides for us out of a customer logic, and we are convinced that transparent quality and result competition lead to a continuous increase in achievable results and a continuous reduction in resources required for this. So, to sum it up, the three principles, outcome measurement, efficiency, and competition, are now a consequence for us of the existing known, established, successful approaches for a modern, forward-looking, inspiring clinic organization. And we are aiming on a continuous development to a reference role model in company and cooperation with innovation partners. So just looking on my watch, I don't think we should go through all the next charts in detail. So we just jump through the charts. Sorry for that. But Daniel told me to make it only brief. So the first clinic that we are intending to open is a 100 beds clinic in the near of Cologne in Batonev. And this will be the prototype for our new, modern and sustainable clinic. And therefore, we're just developing 4 unique selling propositions. It's about empathy, it's about outcome measurement, it's about the focus, and it's about efficiency. So by that, ladies and gentlemen, I thank you very much for your attention. Invitacare has a claim: make life worth living again. Each human being is unique, and so are we. I thank you for the attention. And if you have any questions, do not hesitate to ask. Otherwise, I wish you a nice food and beverage break. Thanks a lot.